It's January 13th, 2010, and Brian is going to give us an in-service on the difficult Airway box. Take it away.
Okay, first of all, it's cricoid pressure. If we ever have to do general anesthesia, it's important to know how to do cricoid pressure. You'll find the thyroid cartilage here. It's the most prominent cartilage of the trachea. Below that is the cricothyroid membrane. Below that's the cricoid cartilage. Taking two fingers, you apply pressure directly posteriorly.
Lean your head back.
Right there. Okay, you'll hold cricoid pressure until you're told to release.
She's still smiling.
During the intubation, you may be asked to assist in some way. You'll be holding the ET tube, and then once the ET tube's in place, you may be asked to take the stylet out while we apply the circuit, and then test the airway to make sure it's in the right spot. And once we're sure it's in the right spot, you can take cricoid pressure off. If, however, we accidentally intubate the esophagus, you need to maintain pressure because we would have just been inflating the belly with more air, and that will help them throw up. So, you want to maintain cricoid while we reset and go again. Okay, if we are unable to intubate the patient, things get a little more tense. We've got other goodies in the operating room. This is an Eschmann stylet, and we do need a couple more of these. It's designed for a blind approach to the trachea. The tip goes up behind the epiglottis, and then it advances in the trachea. You can actually feel the tracheal rings as this bounces along it. If you push it in far enough, it will actually stop because you reach a terminal bronchus that's too small for it to go farther. Whereas if you're in the esophagus, it'll go all the way down because there's nothing to stop it. Once it's in place, we put the ET tube over this and just slide it in, put it in the trachea, and hopefully we're good to go. Next, we might choose to just go with the LMA if we can't intubate the patient right away. You may be asked to open these up in OR1.
Do you want to go ahead and open one, and we can just get it? We can just read.
I'm your assistant.
This style's non-disposable, costs about $300 to $400. Don't throw these away. It advances right into the patient's mouth with a black stripe facing the nose, and when it's in the proper position, it sits kind of like this. It's a good airway, but it's not a secure airway like an endotracheal tube. But this is often the first line in the difficult airway algorithm to try and secure the airway in the pregnant patient, because you'll notice once we induce general anesthesia, often they'll desaturate rapidly. Okay, we have something similar to that. This is a disposable version of an LMA. And then we have something way cool, the Fast Track LMA. This is an intubating LMA.
Oh.
Once the LMA is in place, you can intubate the patient and secure the airway. If none of that works, hopefully everyone's praying by then, because then we got to do something like a surgical airway. And hopefully we never ever get that far into a difficult airway.
So what are some... Oh, I'm sorry.
Surgeons have two things they're trying to do then. Establish a surgical airway and deliver the baby fast.
It's just paperwork.
Oh, you don't do it?
Have you taken a tour of our facility?
You don't do the...
I don't do a surgical airway. I can put that in.
They do the Mondays at noon, and you can register
Okay.
at that time.
So what are some situations that you've seen where you've needed to use the LMA?
Right, so you can come
In an emergency on
The
LND,
tour is at noon.
Mm-hmm.
So if you want
when
to
I have not been able to intubate the patient. These are usually very obese patients, no neck, small mouth opening, all those physical characteristics that tend to lead you to believe it's going to be a difficult intubation. And they're always an emergency, so.
You're welcome.
Are there any other questions? So, does anyone know where the difficult airway box is kept?
In OR1.
No.
Behind
Okay, a
the
little
by
more.
anesthesia cart.
And as you can see, it clearly says difficult airway box on it, not to be confused with the baby med. Well, it is one of those things that we do on the scavenger hunt. That's why there's a D there. It's not for difficult airway.
Oh.
It's for the scavenger hunt.
Oh, it's
So,
on the scavenger.
uh-huh.
During my life loss.
Did someone not know where it was? Just you, huh? No, I'm kidding. I'm kidding. Okay.
Where is it?
Well, thank you very much for our in-service on the LMA and other airway devices.
2 CEUs
How about
for
that?
everyone.
How about the rapid